There's a storm across the valley. The clouds are rolling in. The afternoon is heavy on your shoulders. There's a truck out on the 4-lane, a mile or more away. The whining of his wheels just makes it colder.
Welcome to Community Forum. Today is November 23rd, the day before Thanksgiving, 2022. I'm Priscilla Almquist Olsen, your host on Community Forum, and I want to welcome today a very favorite friend of mine and fellow church member with me at Holy Trinity Lutheran Church, Dave DeVore. And Dave is here today in his capacity as a SHINE representative. And he's going to explain what SHINE is all about. It's a really wonderful gift to seniors. He helps me with my drug prescription plans. Every year we check them because it's amazing the difference in prices from one year to the next. So last year I have had Humana, and this year what do I have, Dave?
I'm not sure what I signed up for.
I think it's Sigma.
Well, Cigna.
Cigna,
Cigna's
yeah.
a good program.
Okay, well, welcome, Dave. It's so wonderful to have
Thank
you here.
Good to be here.
So tell me a little bit about when you got started, why you got started in this program, and what the program is all about.
Well, I started in SHINE back in 2005. I had to take a 2-week training course, which was up in Foxborough, and we was there like 4 or 5 hours a day for 2 weeks. At that point, I took the test, became certified, and started doing SHINE. SHINE stands for Serving the Health Information Needs of Everyone. It's a national program. In Massachusetts and I think 2 other states, it's called SHINE. The other states are called SHIP, State Health Insurance Programs. Same program, different name. What we do is help people with going into Medicare, how to do it, what's involved, what the benefits are. Look at other programs, supplemental health insurance, drug plans, if they're eligible for any public benefit programs, which are in Massachusetts are about 10 you can be eligible for. Most are dependent on income and your asset level. There are a few, like the Health Safety Net, which does not have any asset limit, and Prescription Advantage, which can be a help if you get into the donut hole, or now it's better referred to formally as a coverage gap, help you with your drug costs at that point. And the assets are not a factor in either of those programs. But most of the others, Mass Health, the Medicare buy-in programs all have a limit for assets. And what were your other questions? How did I get into it? I was doing income tax for AARP for the people in the town of Easton, and a woman that was involved with the SHINE program was retiring and asked me if I would consider it. At that point, I didn't even know what SHINE stood for, but I said, I'll take a look at it. And that's how I got involved in SHINE, taking over for her.
Wow. So you have been servicing the seniors of Easton for, is it
22 years.
22 years, okay. And I mean, it's just amazing that you started out with the tax, and then in 2005 you became a SHINE person. And we are also grateful. And people have to make appointments, I understand, and then they come in, and some people, so how long does it take for people to sign up for Medicare and a drug prescription plan and maybe a supplemental insurance program?
Well, my appointment times are an hour and 15 minutes, and typically we can do everything that's required in that time frame. Occasionally it takes a little longer, maybe an hour and a half. Depends what they bring with them. It's important that when you come in to see us, that if you're interested in some of the public benefit programs, we need financial information. If you're just interested in a Medicare Advantage plan or a Medigap plan or a drug plan, we need a complete drug list with the name of the drug, correctly spelled, hopefully, and the size of the drug and the frequency of the drug.
Besides the drug plans and Medicare plans and all these health plans, there are some safety net plans out there. Can you tell us a little bit about those, Dave?
Yeah, there's a couple. These are public benefit programs, and one of them is called the Health Safety Net. Assets are not a factor with Health Safety Net, income is. And what the Health Safety Net plan would do for you, if you have a Medicare Advantage plan within hospital costs are incurred, the Health Safety Net will pay those hospital costs for you. It also provides some help from the community health centers. There's one in Brockton. It does give some dental assistance if you can schedule it, and they're very difficult. But it does help a lot if you have a Medicare Advantage plan with that $390 cost for days 1 through 5. The Health Safety Net will cover that for you. The other program that should be looked at is Prescription Advantage, and I think I did mention that helps you if you get into the coverage gap. And if you are a category S1 to S4, there's no cost to you. And what that does for you, if you get into the coverage gap, your generic drugs, regardless of what tier 1 or tier 2, you get for $12 a month for a 30-day supply maximum. And for a brand name, regardless of the brand name drug, you get it for $30 a month for a 30-day supply. And it can be a big savings if you get in the coverage gap. And there's no asset limit for Prescription Advantage, and income in that is about $3,000 a month. So it's not that high, it's not that low. It can be helpful for a lot of people, particularly if you're concerned about going into the coverage gap. And I have a lot of clients that do that. All of a sudden they're in the coverage gap. What they've been paying $45 a month for a 30-day supply may now jump to $150 per month. Prescription Advantage, it's $30.
And I understand that it's no longer paper and pencil. It's now all computerized. So you had to learn a very complex computer program, Dave. Isn't that true?
Well, it is a good program. It did take a while to learn it. It's called the Medicare Drug Plan Finder program, Medicare Plan Finder. Anyone can go on it. Go to www.medicare.gov and search for drug plans, and you can do it yourself. Most people come in to see Steve Sundell is the other Shine counselor here in Easton. He and I then enter your drugs, but you can do it yourself. And once we set up your Medicare.gov plan or account, which requires a username and password. Generally, your username is your email address, but it doesn't have to be. That stores your prescription drugs that you're currently on. So the next time you come in, we don't have to enter 15 drugs or 10 drugs to your drug list. We already have it. We do have to review it to make sure there's no changes, but that's our starting point. From there, we look at the drugstores, the pharmacies that you want to use, and then we can compare drug plans. Or if you're interested in a Medicare Advantage plan, which is like an HMO or a PPO, they're less expensive than the Medigap type supplemental plans, but you do have to make sure your doctors and specialists accept those plans.
Except you gave me the Cadillac of all plans. And so I can go to anybody. I don't have to get referrals from my primary care physician. And I'm so grateful for that because I've had my right hip replaced. I've had a small bowel obstruction removed. What else? All kinds of things, and never had to pay a penny. And it's called Sapphire by Blue Cross Blue Shield for all of you out there.
Yeah, you're talking about the Medigap plans. There's in Massachusetts, we only have 3 types of plans. There's a core plan, a supplement 1A plan, and a supplement 1 plan. These are called the Medigap plans. With those, you can go to any doctor, any specialist, any hospital that takes Medicare, and depending on the plan you're in, you're covered. On a core plan, you would be responsible for paying the Part A and Part B deductibles. And the Part A deductible next year is going to be $1,600. That's if you're admitted to the hospital. On the Medicare, the Part B deductible next year is going to be, I got to remember these numbers now, $264, I believe. And once you pay that, you've paid your deductible, and then the core plan picks up everything after that. On the Supplement 1 plan, which premium-wise will be higher, of course, your hospital deductible is automatically covered immediately, but you would be responsible for the Part B deductible, the $266. After that, everything is covered. On a Supplement 1 plan, which is somewhat restrictive as far as the people that are eligible for it, all your deductibles are covered. If you're turned 65 after January 1st of 2021, you're not eligible for the Supplemental 1 plan. You have to take either Supplement 1A or Core.
I see. Now, but I have Sapphire, so what's the difference there?
Okay, there are 7 companies in Massachusetts, this area, that offer Medigap plans. Blue Cross Blue Shield is the one called Medex Sapphire. But there are 6 other companies that offer these plans. And these are Fallon, Harvard Pilgrim, United Healthcare, and Blue Cross Blue Shield. Blue Cross Blue Shield basically is the lowest cost of these plans. I think Fallon is a little bit lower. I have no clients that I'm aware of that are on Fallon. Majority are on Blue Cross Blue Shield. And the Blue Cross Blue Shield Medex Sapphire, as Blue Cross refers to their programs as Medex, that is a plan where you're responsible for the Part B deductible. And after that, all your other costs are covered, provided Medicare approves these procedures. If you go in for cosmetic surgery, for instance, Medicare does not cover that.
Oh, what a shame.
I know. And your Medigap plan wouldn't cover it either. But that 98% of medical costs would be covered by your Medigap plan.
Well,
but with a Medigap plan, I must point out, you do need a separate drug plan.
So Dave, does that mean that I cannot have a tummy tuck?
That's probably right, unless Medicare approves it.
Okay. Wow, that's really comprehensive. One thing, Blue Cross Blue Shield is my provider, and when I, some years back on one of my many trips to Sweden to see my family, I called them and I said, you know, what happens if I become ill and I need the services of a physician in Sweden? And they said, oh, no problem. All you have to do is get a written billing statement, and on that, the name of the doctor, the institution you were at, the procedure that you had, and the cost. And so in Sweden, of course, they can do that in English without a problem. But maybe in other countries, you would have to have a translation of that. Anyway, I thought that was wonderful, so I get reimbursed.
That's one of the advantages of the Medigap plans, and as I said earlier, they are more expensive than the Medicare Advantage, but you do have coverage while traveling abroad. And what I suggest that people do, if they need medical assistance out of the country, is put on a credit card, and then when you come back, you submit to your Medigap plan these costs for reimbursement.
Well, you know, the reason I went through that number of information items that you have to have for them is because that's exactly what I did the first time, and they wouldn't accept that because there's no billing statement with it. And so, you know, so I learned my lesson that way.
Yeah.
But so you can submit the credit card payment that you made, but you need to have an official billing statement from the institution And particularly, you need to have a statement about the procedure, not just that you were there at the clinic, say, but that the particular procedure, because they want to see if it is financially sound, you know, that the amount that was charged would be appropriate. So, Dave, you have done a wonderful job, and you know, I know you're an engineer. Now,
Correct.
it seems to me, and you graduated from Penn
Pennsylvania
State.
State University.
Penn State.
Penn State.
Right. You know, that's one of the Ivy League schools. And
No, it's not Ivy League.
well,
Big
it
Ten.
wants to be.
Big 10 school, which
Right,
is
it's one
now
of the
Big
big-
14.
But you've got to be really smart to go there.
Well, I
All
don't
right,
know
they
about
don't.
that.
Oh, he's so modest. Well, anyway, it's true. Dave's one of the smartest people I know, and he has is it a right brain you have?
What?
Is it a right brain?
Right brain? I guess so.
Yeah, because I have the left brain. See, that's why I'm so dependent upon you. So he's the math and science person, and I'm the literature, writing, art person. But it's been wonderful because I feel that I have gotten the best prescription plan. I never argue about the Medicare, the Blue Cross Blue Shield, because you said it was the Cadillac of programs.
It is.
Yeah. And so there I am in gratitude to you for what you've been doing every year. And it's really simple to everybody. He does all the work, but you have to bring the information. So bring a list of your prescription drugs and how many milligrams they are, for example, and what else do you
frequency.
need? Huh?
How many pills a day you take?
Oh yes, how many pills you take a day, and et cetera. And that's important because the price of the plan will depend on how many pills you need per month. And you can also set up a 3-month plan,
Yes.
right?
Yeah, as long as the doctor prescribes a 90-day prescription for you, you can fill your prescriptions for 90 days again, with all the plans. Now, if it's a narcotic drug, however, then you can only fill it for 30 days.
I see. And so what would you tell the citizens of Easton? Why should they come and make an appointment with a SHINE officer? What's the advantage?
Well, the advantage is, one, cost savings. You get on a program that is best benefit to you and at the pharmacy that you want to use. I probably should say a little bit about the Medicare Advantage plans, which are HMOs, Health Maintenance Organization, and PPOs, which are preferred provider organizations. These are a less expensive to you medical program, but there are a lot more restrictions. You have copays when you go to the doctors, and there's a hospital charge with most plans of roughly $390 a day for the first 5 days. Then after that, the plan picks up the full cost. But these HMOs and PPOs, there's a lot available now, are $0 per month premium, and you do have more restrictions of getting referrals with an HMO. With PPO, you do not need a referral, but you do need to make sure that your doctors and your specialists accept these plans. But they are less expensive. If you're a healthy person, only go to the doctors twice a year. You can get by with a 0 premium plan. Your primary care physician is in the network, and you pay 0 when you copay, and it's a very inexpensive program. But there are costs if you get hospitalized. And there are costs, for instance, MRIs. Typically, with the HMO and PPO, you would be responsible for $325 for the MRI. But the overall less expensive. They do come with a drug plan. So the drug plans are attached, don't need a separate drug plan.
Oh, really? Okay. So there are lots of choices out there for seniors and anyone else. And so, Dave,
Well, you did ask what the advantage was.
Yes.
I've had some people come in that are on a drug plan in 2022, and we look at it for 2023, and we might be able to save them $1,400, $1,500 based on the prescriptions that they're presently taking, which is a substantial amount. I did a quick survey a couple days ago for the people down at the Council on Aging, wanting to know what the cost savings we have for people. And I went back to October 26th up to the present, and I estimate I saved X number of clients, probably $18,564 for next year.
Oh my goodness.
So
Wow.
it can be substantial.
Yes. And I was amazed when we sat down and went over the plan that I'm currently on and compared that to other plans, and we found one where the drugs, I think I have just 3 prescription drugs, and the savings now is amazing. And what's also amazing is that drug plans change their fees every year. So you could be paying $4 for a drug, you know, and then the following year with the same company, that charge could be $24 or $54. And I think I was paying $51 for a drug that's now going to be, is it $0? I don't know.
Probably not 0, but probably
Very
$20.
cheap, right? And all 3 are just so cheap in this new plan that Dave set up for me. And so the savings is wonderful. And so I really appreciate what you do. And for some of you techie people, maybe you can go online as Dave suggests and you don't need them. Well, think about it. Just think about it. You need Dave, you need Steve Sandell too. The 2 of them are the wizards of Easton in terms of all these health plans. So even if you have a question, you know, make an appointment, come in. He would love to just talk to you for 15 minutes
Right.
instead of an
Yep.
hour and 15 minutes. So and the point is check every year you should be checking the plans that you have so that you're saving money, you're getting the best plans. Because as I said, they change prices every year. The same company that charged you $4 one year is now going to charge you $54 the next year, and you're not going to know that unless you talk to Steve and Dave DeVore here. So, Dave, thank you so much for coming. And the benefits that you give Easton residents is just amazing. $18,000 plus that you saved just from October.
From October to mid-November.
Oh my God, that's 6 weeks.
That's just by changing plans, picking the right drug plan. Drug plans change every year, premiums change, their formularies change, which is important. I had a client recently that was covered this year, 2022, with a particular drug, a brand name, on her plan, and next year it's not uncovered. So she would then pay next year the full retail cost of that drug for the pharmacy that she went to.
Oh my goodness.
It was an expensive drug.
Yeah, yeah. And then there's also preferred. So where was I going? I was going to CVS, and I can go to CVS on one of those 3 drugs, but I better not get the other 2 from them because it's much more expensive. And so now I go to Walgreens.
Right.
And
Yeah,
so you get all that information from Dave.
There are 3 levels of pharmacies with most of these plans, including the Medicare Advantage plans. You have a preferred pharmacy, a standard pharmacy, and out-of-network pharmacy. An out-of-network pharmacy, you may as well not have a plan. But the preferred and the in-network or standard pharmacies, the preferred is the lower cost in most cases, not always, and the standard or in-network or network pharmacies are a little higher.
Yes, and also there's a mail-in drug plan too.
Yes. Most of the time the mail-in with a plan is preferred.
I see. So there's a cost savings there, and also for those seniors who have mobility issues, the mail-in plan is certainly appropriate. Dave, thank you so much for coming. I know you have a busy schedule, and I appreciate that you're taking the time. So now, December 7th is the deadline?
Deadline is December 7th, Pearl Harbor Day.
Okay, and that's to sign up for?
for a new plan. Now, in the area of Medigap plans, that's open enrollment in Massachusetts. So you can make a change at any time during the year. There are some restrictions, but it's not governed by the open enrollment period, which is October 15th to December 7th. So the Medigap plans are variable during the year. Not so with drug plans.
Yes, and I was able to switch from Core, Blue Cross Blue Shield Core, to Sapphire anytime during the year, without penalty. So now it's November 23rd today, and you have actually 2 weeks before the deadline. So either go online or see if you can get an appointment. I don't know if you have any appointments.
We're booked for appointments right up to December 7th right now, both Steve and myself.
Okay, so you better. So what's the online address?
www.medicare.gov, and you get a window coming up, and you kind of scroll down a little bit, and it says look for health and drug plans.
Health and drug plans. Okay.
That's what you click on, and go from there.
So Medicare.gov, and then scroll down, and find healthcare plans and drug plans.
Health and drug plans.
Health and drug plans. And so start doing it. You got 2 weeks to figure out how you can save money. And next year, make an appointment with Dave.
Make it early.
And make it early. Or Steve Sindell. Dave DeVore, Steve Sindell. Those are the 2 people who you can trust and who can save you money and put you on the right road to good health. Thank you, Dave, again.
You're welcome.
Appreciate your
Glad
coming
to be
aboard. And this is Priscilla Almquist Olsen for Community Forum, November 23rd, 2022. And I hope you enjoyed this program and learned a great deal from Mr. DeVore, our Mr. Shine man. And until next time, be well.